We're good. Okay, awesome. And I'm going to double check and share my screen. Yes. Okay, perfect. So before I do that, I will just introduce myself for anybody here that hasn't really met me virtually or in person. My name is Kelsey, and I'm Vice President of the IVSW alongside Augusta here. Um, and so I came to veterinary social work kind of in a roundabout way, as I feel like a lot of us do. So I started out working in veterinary medicine. Actually, Jennifer Fitzpatrick here, I'm going to call her out. She was one of the technicians that I worked with over a decade ago. Like it was a while. She was one of like my mentors in the field. And I kind of went through that for 12, 13 years and knew I wanted to do something different, but didn't really want to leave the field. I already had my bachelor's in psychology, so I was working with a criticalist at the time, and she was like, I think you would do really well in veterinary social work. And I was like, I don't even know what that is. Tell me more. So I literally that night went online, went on UTK's website. I was like, oh my gosh, this is perfect. I couldn't imagine a better fit. So I applied to grad school like that week. And as soon as I got accepted to grad school, I applied to the VSW program here at, oh, I say here, I'm not in Tennessee, but UTK's veterinary social work program. So I am now a licensed master social worker. I'm still completing my VSW. I am almost done. And I also, through all of that and through my connections at the IVSW, started working with Not One More Vet, which is a veterinary mental health nonprofit. If anybody is unfamiliar, we have a lot of different programs. I co-manage a program called Clear Blueprint Program, which I'm going to talk a little bit more about tonight, just because that is where we, I think, have really maximized kind of VSW in this different space since we aren't a brick and mortar organization. We are completely remote. And this is also a remote program that we do virtually with everybody. So I'm going to try to share my screen. It's going to work, hopefully. Okay. Let me put it on slideshow mode. Okay. It says it's loading. The moment of truth. Okay. Can everybody see my screen? It should just say clear blueprint.
Yeah.
Perfect. Okay. Amazing. It's working. We've got this. Okay. So what I'm going to do is just really give you a brief overview of what kind of how the program came to be and what the program consists of. I will say this is not like the full spiel. This is a little bit more of a condensed version. So if you do have questions, I have a QR code at the end to your website as well as my email address. So if you need to reach out directly to me, you are more than welcome to. But to start, Clear Blueprint is essentially a workplace wellness certification or a practice certification program. You can kind of think of it like AHA accreditation or fear-free certification, where we have certain criteria that we work on with clinics. We were developed by a wide range of people, including some VSWs and some other mental health professionals that had a lot of input in the development of the program. We also worked with veterinarians, vet techs, other support staff, and other more like veterinary business minded individuals to kind of make this program come to fruition. The goal is a little bit different than some other practice certifications out there in that we really want to make this program as adaptable as possible to as many clinic and veterinary medicine settings as possible. And so that's why I say this isn't the full in-depth information tonight, because it can really vary depending on the clinic that you're working within. You know, if it's a small one doctor practice versus a large teaching hospital versus like a shelter medicine setting, it can all look really different. So we've really tried to make the framework of this program as scalable and applicable to the widest variety of workplaces that we could. And the other intention is for this to be very focused on empowering the team rather than us kind of serving a consultant role. We really we provide information and resources to the team, but from there we really trust and believe that there are people within that clinic that have solutions, that have ideas, and our goal is for this program to kind of be the jumping off point for that, or the safe space for them to collaborate together as a team to kind of solve any concerns that they might have or any areas that they really want to improve on. And we want to take a look at the whole picture. So we do really prioritize all staff well-being, not just one part of the team over any other. And a lot of, there we go. Okay, being a little laggy on my end. But part of what we have or how we have developed this program also comes from studies, ongoing studies that have been done primarily from Merck Animal Health. If anybody's not familiar with them, they are kind of a powerhouse in the veterinary community in terms of veterinary industry products that they create. And they do have a pretty big investment in the well-being of the profession. And one of the ways in which they are invested is by being our exclusive sponsor right now. They are responsible for the funding of this program so that I can be sitting here talking to you all and working with these teams. And their studies have found several themes. They've been conducting these studies since around 2017. And they just published, I haven't even updated this slide yet because they just came out with this past year's latest results. But we still see some common themes even throughout the most recent study. And things that we see are how important teamwork and trust in the workplace is, as well as good communication back and forth between both among staff members and also when we're looking at leadership or network organizations that have, leadership and people that are further removed from the actual clinic. The way we communicate amongst all of those and together is really important. And then also the other theme that we really see and that we kind of try to address with the program is making sure staff members have enough time to provide the quality of services that they would like to. I think we probably know, or at least have some familiarization with the fact that when we are really pressed for time or when we can't, for whatever reason, whether it's time or financial constraints, provide care at the level with which we would like, it is very difficult emotionally. And it can be a really big contributing factor to things like compassion fatigue and burnout. And then also, what I would kind of call, for lack of a better word, like mental health literacy, knowing that there are mental health resources available, and really as leadership or owners of the practice, making sure that your team knows that these things are available. Or if you're a VSW in the clinic, ensuring that the staff have access. That's another really important factor. And then lastly, they do find that employee assistance programs and other health insurance covering things like mental health care is another really vital aspect. So while we can't necessarily provide those things with the program, we can recommend them and do recommend them to the clinics that we're working with and kind of provide that education and knowledge of the importance and the fact that we are also seeing this in the research that having access to these things and a shared language around things like mental health is really important. And so that's part of what we provide in the program as well. One exciting thing that has been new with our program this last year, before I kind of dive a little bit more into the nitty gritty, is we have been bringing on a lot of MSW and VSW interns. So I also wanted to take a moment and just touch on that and let you all know what this is looking like, and keep in mind, in case you know any budding VSWs and you hear about this program, you're like, ooh, this could be a really good fit for them. Send them my way. So right now, we really honestly try to make these internships as relevant to the individual as possible. So things that they do on a fairly consistent basis can look like assisting us with outreach, working with clinics. So they might do communication for us. They might go to meetings with us or for us. They help us with social media if they're interested. We also do a lot of program evaluation and feedback with them. We really value the different perspectives that all of these interns bring, and we really want their feedback so that we can make sure this program is as successful and useful to the individuals using it as possible. I've also had interns help us with presentations, webinars, data analysis. So it really, there are quite a few options, even just within the Clear Blueprint program. And we try, like I said, to really tailor it to the students' interests. And of course, we're making sure we're meeting their educational requirements. But just like with the program being scalable, I try to do that with the internships as well. So that way, each student is getting what they need when they're with us to the best of our ability. So it's just an exciting thing. We are looking to really continue expanding and finding new ways to utilize these interns in a way that is not just beneficial for the program, but for them, so that they can come into the field of VSW feeling like they are pretty well-rounded and kind of know what all is out there, and also feel like they have the skills to contribute in whatever area of social work they may be interested in. I'm going to pause and look at that. Oh, yes. Thank you, Augusta. So we have 6 interns right now from, I want to say 4 different universities. So we have UTK, we have University of North Alabama, University of Denver, and University of South Florida. And we did also take our first BSW student this year as well. So we're now doing BSW, MSW, and VSW. Our MSW students aren't always part of the VSW track. It is not necessarily a requirement. However, it is, I think, just a good kind of niche opportunity for our VSW interns. And that's obviously where our UTK students are coming from. And I lost my train. Anyway, it'll come back to me. So yeah, we've got 6 right now. We do have at least 1 more planned for the summer semester, and we are going to be potentially putting out some feelers, like I said, in the upcoming semesters if anybody knows of anybody or might have any interest. As I mentioned before, this is also a fully remote internship, so there's nothing in person that is required. We do have sometimes, depending on your region, opportunities where they may be able to attend. We had 3 interns go to VMX with us this year, and we have another intern that's going to be at Western Veterinary Conference this coming week. And so when we have those opportunities, or if there's more local opportunities, we love to be able to offer that to them. And then in terms of the remote work, again, I try to adapt it as much as I can. I've got some students that prefer a little bit more of a hands-on, kind of us meeting a little bit more frequently, or meeting with other team members a little bit more frequently. And then we have others that work pretty well independently, and those that fall somewhere in between. So again, I try to really I can't think of my words. Try to really, I guess, adapt. I keep saying that word, but we're just going to roll with it. Just really tailor. Thank you. That was the word. We really try to tailor it to where they thrive. And that's kind of our primary goal. So that's a really, again, kind of crash course overview of everything that we do with the interns. And I will be happy to take questions, or again, you can always reach out to me directly if you have questions related to the internship placement that we do have available. Or to just learn more about how we did it in case you're looking to incorporate VSW interns into your work in the future. You can always also reach out to me for that as well. I'm going to try. My little clicky for changing slides is gone. So we're going to see if it'll do this. There it goes. Perfect. So this is kind of going back to what the actual process looks like for a team that is going to potentially work with us. So the first thing that we do is we meet with at least 1 member of the team. As many that would like to attend are always welcome. I will say usually it's whoever submitted what we call an interest form, which is just basically the way of saying, hey, I would like to learn more about this, and we'll go ahead and schedule something with them. So it's usually that person and maybe a veterinarian, practice manager or practice owner, but it is open to anybody on the team, regardless of, their position or what have you. And so we meet with them and we just basically give them a little bit more in-depth version of what I'm giving you tonight. And then we have time for questions and can kind of address any specific concerns that they may have or whatever else it takes to kind of determine that goodness of fit and see if their team sounds like they could benefit and would be interested in working with the program. We'll just say for easiness sake that we have this meeting with them. They say, "Ooh, this is cool. We want to continue." So what happens next is we need them to identify a clinic advocate. Again, coming from more of the um, perspective of wanting to empower the team members, we usually work with 1 to 2 clinic advocates, and they are basically our primary liaison with the team. And they are going to be kind of leading the program from within. So they're going to be kind of communicating with us the most, and then also dispersing information or other materials that we give them. They will be responsible for dispersing that to the rest of the team. It does come with a job description of sorts, just so that way whoever the clinic advocate is can kind of know what they're signing up for. I would estimate right now that the program requires about an hour to 2 hours a month of time for the clinic advocate. Our only requirement for the clinic advocate is that they are a paid staff member. We don't want anybody kind of doing this extra work unpaid because we do know what they're doing is really valuable. So we just ask that it's somebody that's interested in pursuing something like this, that they are passionate about it, and that they are a paid staff member. So we've had practice managers, we've had client receptionists and front staff workers, we've had technicians and assistants all take on the role. So it's really up to the team and up to the individuals on the team in terms of who the clinic advocate is. And then once we have a clinic advocate, we do set up an assessment date with them. Right now, we roll our assessments out on a monthly basis. So they kind of pick whichever month works best for them. And it can be as soon or as pushed out as is necessary for them. There's no like pressure to start right away or anything like that. So we go ahead, we pick that date, and on that date, we send the clinic advocate a link to the assessment. It's all online. It takes typically, I would say, like maybe 10 to 15 minutes tops for them to complete. And then instead of having a deadline where like we have to have everybody's assessments in by a certain point, all we ask is that um, 80% of staff respond before we continue on to the next step. So the assessment process can take, a week. It can take 6 months. It really depends on the team. And a lot of that is just because we know working in veterinary medicine can be very hectic. And finding time even for a short assessment can be challenging. So once we hit that 80% threshold, our team will then go through those results and basically parse the responses. We anonymize all of the data so we don't provide the team with anything identifying in terms of responses. And then we meet with them for what we call a roadmap session where we go over all of that data. So we let them know the areas that are strengths of the team or of the organization and things that we think that they will really be able to lean into in the future. And then we also identify areas that could use some more attention or some more development. And once we do that, that is the point where we determine if they're certified or not. They have to have a passing score of 75% or higher on each of the areas that our assessment kind of breaks down to. And anything below that would not receive certification, and anything above that they'd be considered Clear Blueprint certified. But however, either way, whether they certify on the first go round or not, they still get access to all of our educational content and resources. So that will be available regardless. Oh, hold on. I'm just going to answer some questions really quick. So yes, as Augusta pointed out, we are not limited to traditional veterinary clinics. We work with shelter medicine, teaching hospitals, general practice, specialty, emergency. We've also done some wildlife rescue and rehab veterinary clinics. We've been working with one in Minnesota. So basically, as long as veterinary medicine is involved, even if it's a little bit of a non-traditional setting, we are more than happy to, again, adapt the program to work for them. And the assessment, Kelly, I'll talk about it. You didn't miss it, don't worry. I'm just going to talk about it and kind of show that on the next slide because it is a little bit of a, it can be a lot of steps depending on um, where the team is at. But so yeah, they either certify or they don't based off of that roadmap result. And then we provide them with the link to all of our educational content and resources that are housed in our learning management software. Now, I will say people hear learning management software and they think it's going to be like a course that they have to take. And I will say it is more of a place where we house everything and make it as easy to kind of sort through as possible. There's not like quizzes or homework tied to these learning modules. It's just solely educational information and resources. And then we also have some kind of activity ideas that we provide as well for kind of working on the team in some of these areas. And then teams, if they don't certify, they have up to 18 months from that roadmap date to work towards certification. So we try to give a pretty broad window again, just because we know things get really hectic and we want to be as flexible as we can. And so to answer Kelly's question, the assessment process or the assessment itself is a 12-question survey. Our 12 questions kind of break down into 10 different buckets or topics that we consider to be our educational content. And it's also how our learning modules are created or according to these different categories. And so, for example, we might have questions that pertain to peer relations, to community relations, to the clinic's mission, those types of things. And so we just have a couple of the 10 that have a couple of extra questions. That's why it doesn't match up as perfectly. Some subjective and objective questions kind of in there. They are all on like a Likert scale. So it's going to be strongly disagree to strongly agree on the questions. And then we do require 80% of staff to participate rather than having a deadline of needing to submit it by a certain date. We just go off of who has participated. And then for each of those 10 kind of learning modules or topic areas, the passing score is considered 75%. So they have to get a score of 75% or higher on 8 out of our 10 areas to be considered certified. As I said, regardless of the certification result, we are here to provide support. So even if they're certified or even if they don't certify, we are always available to them. We communicate sometimes via email, meetings, whatever it may be, to provide that support. And then we do have our own kind of regular check-ins that we will initiate, but we are always available to them even outside those touch points. And then, like I said, 18 months towards certification. And then the scoring is going to be consistent with our initial assessment that we do, but the questions will be different. So it'll be more focused on the areas that they were working on. So like, let's say they failed, they didn't get a passing score on the peer relations. And so they're working through that. The questions that they retest on are going to be focused on those peer relations. And then our certification is valid for 5 years. I will say we do have, I don't think I included it in here, but we are a nonprofit and we do get some funding from Merck. We do have a small fee associated just to ensure that we always have staff members available to support the team and to make sure we're able to continue making improvements in the program. So like I said, ongoing support can look different for everybody. We have done things like brainstorming with teams to think about activities to help them work through learning modules. We've discussed implementation challenges that some folks have. Sometimes there may be teams that don't have as much buy-in as others, and kind of how do we navigate that? And then providing any sort of additional support or resources for anything that specifically the clinic might be going through. An example for that is we had a clinic that had a patient pass away in a fairly routine surgery. So it wasn't something that was necessarily expected. So they reached out and we provided them with some additional resources and support to kind of get them through time. And we try to also be flexible and respectful of everybody's time when it comes to these things. So we can provide that support via email, via virtual meetings like Zoom or Google Meets, phone calls we've done. And then also we've done some more like asynchronous communication with teams. They might create like a Google Doc of questions or things like that. And we'll all kind of work off of that document to provide each other feedback or support. And then they keep access to all of our content for as long as they are active in the program or certified. And we also, that includes any updates to the modules. So any updates we make to our content, everybody that is active in the program will have access to that. We do try to update the material at least a couple of times a year right now. We go through an evaluation process and add in new resources, swap them out for anything that may not be as relevant. And we just want to make sure that everybody always has full access to everything that we have available. And so that remains available to them throughout their certification or as long as they're pursuing certification. And I think, oh, I lost my telling you, me and technology, you guys, sometimes. And so this is just the little end. So we've got the QR code will just take you to the Clear Blueprint landing page, where if you are working with a clinic or if you know of a clinic that may be interested, you can send them there. And they do have to create an account to submit an interest form. So it does take a couple of extra steps. I like to pre-warn people of that it takes a few minutes to get through. But it's just so that way we can kind of keep track of things on our end and make sure like we're not having two separate meetings from people from the same clinic or things like that. And then my email is also on this slide. So if you have questions about the program or about internships or anything, you can always reach out to me. But that is kind of the Clear Blueprint crash course. I wanted to make sure I left some time for questions and for conversation. Because I know this was like a lot of information to kind of throw at everybody. And I'm going to leave this up for just a minute and then I can go ahead and stop sharing. But I just want to make sure if anybody needs it, they have access.